In the past decade or so, there's been a remarkable increase in the oropharynx tumors, where HPV, or human papillomavirus, has been much more commonly involved in the development of these tumors. It is a sexually spread disease as far as the HPV is concerned, so it's becoming much more common, especially in the younger patient population. The HPV virus can remain dormant in tonsil tissue in that area for many years, but acts as what they call a carcinogenesis. In other words, can incite a cancer or carcinoma to develop. And there are different strains, and the most common strains and the most dangerous strains are type 16 and 18. And that's the type that most often is associated with oropharynx cancers, as well as in women, cervical cancers. Screening for HPV is very difficult because there's no simple blood test that can pick up HPV infections. The only way to identify it is actual examination of the tissue, and that will require biopsies. And we actually have to do extensive biopsies of the throat because you can have a microscopic primary site and yet significant lymph node involvement with metastatic disease. And that's typical for HPV positive oropharynx tumors. You see it all the time. This is very, very common. You're talking about something that is epidemic proportions, that is hitting younger people, whereas traditionally there's an older patient population for oropharynx carcinomas. Now we have younger patients being involved with no history of smoking or drinking, developing significant lymph node involvement in the neck from these HPV-associated tumors. And that's something that has to be addressed, and it's an evolution in the diagnosis and the treatment of these lesions.